Hi, my name's Dr. Truesdale, and I am a double board certified facial plastic surgeon, and I work in Beverly Hills, California. I perform facelifts, rhinoplasties, eyelid surgery, and much more. My job is one as an entrepreneur, a businessman, a husband, a father, but a surgeon who gets to transform patients' lives. Beyond the surface to me means the transformation and the journey that my patients go through. It's not about the external, it's not about the facade, it's not superficial. We are going to dive in to what makes my patients tick, a little bit about my life, and all the drama of owning and operating a practice in Beverly Hills, California. It's plastic surgery, but it's so much more. One of the decisions that we made to actually come to Beverly Hills to practice was we wanted to be a big fish in a big pond. I knew that I had something inside of me that I wanted to share with the world. And so by coming here in the most competitive market, I knew I had something to offer.
Come in.
Hello,
Hi.
Dr. Oliver.
Hi. My name is Dion Oliver. I'm from Baltimore, Maryland. I'm an OBGYN.
Nice to meet you.
You too.
Welcome.
Than's you.
Your travel was okay?
It was great.
Good.
It was great. I have been in practice for about 23 years. I work really hard. I'm a single parent. I have a 13-year-old daughter, and I also teach exercise classes. I'm into fitness and health. I'm vegan, semi-vegan. I'm eating salmon now.
Well, let's review our game plan.
Okay.
Tomorrow's a big day.
Yep.
How are you feeling?
I'm good. I feel good. I'm nervous, excited.
Yes, it's normal to be nervous, especially because you're not used to being on this side of things.
Absolutely.
I had my appendix removed a couple years ago, and it feels different being the patient. So
I'm gonna be a good patient.
You're gonna be a good one?
I promise.
Whenever I'm taking care of someone in medicine, or you can ask any doctor, any nurse in medicine, we always get a little nervous when we treat other people in the medical profession. Not because we're afraid of that they know something, but because we don't want anything to go wrong. Now, we as doctors are notoriously bad patients. We don't take instructions well, we don't follow instructions post-op, and so I was a little nervous about Dion. Tell me what bothers you.
I don't like this. I hate under my eyes. You know, my family, we always have dark circles, but I feel like over the last couple of years, they've gotten really darker, especially here. And then this little bag here, that you don't see on this side is just, I notice it. I've noticed too that it seems like this is starting to fall a little bit. So my eyebrow here is closer to my eye than it used to be. But it's really this area here that I feel like over the last couple of years, the jowls have been an issue for me. I got a little bit of a chipmunk here. Yeah.
Okay, so this is 29 for next month, so we should probably go.
You guys are really killing me.
I know.
You guys are really killing me.
And even now we're going to be 30. We're going to book 30 for next month. Probably going to book 35 at this point, the way we're doing.
But we don't really have time though, that's the thing.
I did know I wanted to be an entrepreneur. I wanted my own business. But it's pretty daunting thinking about moving to California and starting a practice in the busiest and biggest, kind of one of the meccas of plastic surgery in Rodeo Drive. And so it's intimidating. But I started, putting up ads on Instagram, Botox and fillers. And at the time, it was all about just attracting patients in the door, getting experience and showing people what I could do. Those patients, I built trust and had great results, and my practice grew very quickly. And so by the time I'd finished fellowship, I had done a bunch of surgery, had actually saved a bunch of money, and my wife and I took the big plunge of opening a practice, building it up from the ground up in the busiest place you possibly can imagine, one of the most competitive markets in the world, Rodeo Drive in Beverly Hills. And so we built the office up from the ground up. Basically, it was a shell of an office. There was nothing here.
We have consultation patients that are flying in for consultations.
I booked one of those today. That's funny you say that.
Yeah. So you got to, before we schedule a case to move patients, look at the at consults.
Yeah.
Okay, and we probably should write that in there too, cannot be moved.
The first person that we hired was Maria. Maria brings sassiness, she brings spunk, she brings a shoulder to cry to for my patients. She's basically a workhorse here in the office, but she is an amazing resource for my patients. Part of that is because she's been a patient of my own, so she's gone through her own personal facial plastic surgery journey with me, and that's been fun to kind of work with her. Basically keeps things going in terms of day-to-day in the office, helping manage and coordinate things with the rest of the team, running payroll. She's also a fantastic patient care coordinator. So what that means in my practice is she's a point person. When a person comes to me and they want something done, she's the person that they'll lean on.
I can walk you through it. So, after surgery, you're gonna have a nurse pick you up from the surgery center, and they're lovely ladies. They all work with Dr. Truesdale in the operating room. And I've been in this field for, I would say, 25, 30 years soon. And I've always been in otolaryngology and head and neck and facial plastics. So, and I love this field. So I don't know, it's just, how am I gonna say it? It changes people's lives to the better and make people beautiful. And I never seen any doctor really do beautiful ethnicnosis, and I've always wanted to do that. So be in that field with someone who could do that. So I knew I had a job. I just felt good.
Dr. Truesdale is burned out.
I know. It's not our fault. He asked for this. It's not.
Believe me, I'm just doing my job.
I know.
I'm like, them too.
We start out strong.
There's a message for you.
3 in 1 day.
Can you make it bigger? I don't have glasses.
You don't ever wear glasses. How do you see up there?
I have them that big. I have my letters big.
Cleo.
You need to go
I know,
get yourself some
I
glasses.
need
glasses.
I need glasses.
Addie said she was scared in the car the other day because you couldn't read a sign. This off. She couldn't. Addie was telling me there was a sign that
You're not going to teach her how to drive.
that was on.
No, it's not my vision, it's my anxiety. I'm not going to be able to teach her. No.
Who's going to teach her?
Dr. Truesdale.
Yeah, right.
In the Tessie.
In the Tesla.
How is he going to have time to do
In
that?
the Porsche.
We have 30 surgeries for next month.
So you see your jawline. Obviously there's this loose muscle. We're gonna link this up. This little fullness right here is called your submandibular gland, and it makes saliva that empties into the floor of your mouth. I will need to trim that. When I do that, you'll have more space underneath the jawbone, so things will be that much more sculpted. A lot of doctors don't take that out because they don't feel comfortable. The reason why is it's deep in the neck, it's close to the marginal branch of the mandibular nerve, right, the facial nerve, and big blood vessels right behind it, right, facial vein, that kind of thing.
Over the last, I say 5 years, I've seen some changes in my face, and while I think I can control what goes on with my body, it's very hard to control how you age in your face. And I'm fit, and weight loss in your face doesn't look as good as it does in your body. And so I have recognized a change in just my overall facial appearance, and it's something that I want to do something about, not for anybody else, but just for me. So when I look in the mirror, I see what I can potentially be or what I looked like a few years ago. So it's not for anybody else, it's because I want to do it for myself, to look better and to feel how I feel on the inside.
In terms of your lower face.
And then the cheek here, there's a difference. And when I smile, you can definitely see the difference in the cheekbones. I don't know if this is falling more than this side.
It's two things. So there's the bone, and then there's the soft tissue on top. Think of the face as a house. The bone is the structure. So it's the bricks, it's the foundation. Everything sits on top of that, right? So the paint, the wallpaper, all of that. Your bone is different, one side versus the other. The cheek, that's normal. Every person's face is asymmetric. What you're actually seeing, if you look in the mirror, from point A, midline, to this point, it's wider, right? And more flat. Whereas in this side, it angles up and back kind of more gradually. Whereas here, it kind of comes out wider and then it comes back.
Some of the questions I had were very technical questions, and I was concerned about the scarring. Black women tend to hyperpigment and keloid, and I wanted to make sure you know, there would be something in place if that should occur, and he was able to answer those questions.
All skin can keloid. A keloid is a tumorous growth along basically an area of damaged skin. So what this tumorous growth can form is basically a painful lesion, something that's disfiguring, unsightful. And so there are certain things that we do during surgery to prevent that. The number one thing is no tension. I don't want any pull or stretch on the incision, and I do everything in my power to make that as smooth as possible. And you see how much more youthful you look.
Absolutely.
When we do that. You had asked me about your scar and your hair. I'm gonna keep your hairline where it is, and I do a bunch of special things to keep your hair living and healthy. Now, whenever you're making a cut, right, we wanna stay away from the hair follicles, so they're like the little root system under the skin. The hairs grow through, right? So when I make my cut, I bevel my incision. It's called a trichophytic incision. I also preserve those hair follicles by minimizing cautery. So minimize bovie, bipolar, so that I don't fry those follicles. That does a couple of things. When the hairs are growing through, they'll grow through the scar. So you won't be able to see the scar as much. Yeah.
I think that someone who is, especially when you're getting your face done, someone who's African American, who understands some of the challenges that we face as African Americans, as far as I said, hyperpigmentation, keloiding, and just from a cultural standpoint, we want to look a certain way, I think. And I don't think looking, you know, tight and unnatural and having just a youthful appearance and being more natural in the hands of a black man who sees black women, who understands how black women should look.
To be a plastic surgeon, a lot of people think that you need to be cocky. Well, that's not true. You need to be confident, because anytime you take a blade and you're gonna say, I'm going to cut you, you need to make sure you know what you're doing, and you need to know that you're gonna make them better. So there is a little bit of a self-assurance that you need to have as a surgeon, because at the end of the day, you have a belief in yourself that whatever you're going to do, the patient will be left better than when they first met you. Hey Maria.
Hey, what's up?
What's up? Let's chat. How you doing?
How are you? How was surgery?
It was good. It was a little tricky, but she looks amazing, which is great. That's all that matters. So let's talk about you.
What?
You dating?
My dating life has changed dramatically after surgery, of course, because I'm now looking so much hotter. Okay, I'm kidding. But I'm more vibrant, I'm more confident, I have more fun. So yeah, it has changed. I'm dating younger guys. I need a husband. Come on now. Between move and this place, how do you think I can find love right now?
You could totally find love right now. Look at your new face.
That is true.
Yeah, I mean, you sell it every day.
Guys, you don't even know. You don't even know. I have this guy at Trader Joe's.
All right, I'm excited today because Maria's got a new face. She's got to use that face. Part of that is feeling confident in the way she looks overall, so she needs a new fit. I brought in my cousin, he's a stylist. Jordan's here, I'm gonna introduce him to Maria and they're gonna get acquainted so that he can be her own personal stylist. He's done this before, but I wanna really highlight his abilities and highlight Maria so she feels more confident and gets that date that she wants to have.
Hey Jordan, how are you? Come on in.
I'm good, I just wanted to come chat about some fashion stuff.
I was just going to say I need some help.
So, what's new? Tell me what you want to change and revamp about your look.
I don't know. I just need to update it because my daughter says that I used to have style and something went wrong around 49-50.
49-50.
Oh, shoot, my bad.
No, you definitely don't look your age, but I definitely think there's some things that, you know, you can do to revamp. It just depends on what areas you want to focus on. So is it something like showing a little bit more of the girls, or you want to show a little bit more skin, or cover up arms, or it just depends on what your vibe is and what you're more.
I want to look a little more up to date. Okay. I still want to be comfortable. Okay. I'm not big on heels no more.
Okay.
I do like pants over dresses.
Jordan moved to California and Los Angeles a few years before me, and I knew he came out here with dreams of becoming a celebrity stylist. He's always had a penchant for fashion. He's always been a little fashionista. Even when we were little, I remember playing with him. He'd always be into how things look and the aesthetic.
It's amazing to see Carl like in this new light of his profession, because he's always been this super charismatic, like well-rounded, multifaceted individual, from art to like music to even now with his artistry through, you know, surgery. I could totally see him being this type of person in the future just because he's always been great. So I'm excited to go on this new journey with him to help, you know, his clients and see just a transformation of, you know, lives. But I definitely want to see those legs. I want to see the legs in the skirt.
You are so cute. I don't know about that, but we can try. I'm open to trying.
For Dr. Dion, I performed a deep plane face and neck lift as well as fat transfer. We had a very serious discussion about where can we take this fat from. I wasn't sure we were going to be able to get enough fat for her to actually put this into her face. Thankfully, we were able to steal some from her inner thighs to process that fat and inject it to restore volume. I take that fat, I process it, and I actually used it to sculpt and restore volume in her temples, her under eyes, her cheek, and her chin. This has done so much to make her look more youthful because as an extreme person and fitness fanatic, she's lost some volume in her face. So restoring that really takes her back in time. When she showed me a reference photo of her years ago, her face was more full. So I used that as a guide to not change her too much, but to take her back in time. Hey, look at this young woman. You look fantastic.
Thank you.
Super, super excited for you. Years younger.
No, I'm so happy. You know, my body and my face finally.
They match.
My surgery was actually 6 days ago because we're leaving tomorrow, so I couldn't be here for day 7. So they were happy to accommodate me. I feel great. The surgery went well. I had a little swelling. I was telling Dr. Truesdale that this ear is a little stuffed up because it's the swelling. But other than that, I feel great. It's a little tight underneath the neck, but I had very little pain. I didn't even take the pain medication.
Your temples, more
good.
More
yeah,
full.
both are even.
Yep, the under eye area is still a little swollen right now, but you can get the sense of what we're looking like, and then that bag that you were kind of bothered by should be gone.
Very pleased.
I was looking at your before and afters, and your mole has moved about an inch and a half. I treat a very diverse practice, very wide array of different types of patients, from dark to light, black, white, Asian, Latino. Everybody comes to me. And so one important aspect of being a plastic surgeon is to modify your plan and what you do based on the person's physical structure. And people want to see that you've done work like them before. She found that in me. She also really appreciated that I'm a Black physician. There are not many Black facial plastic surgeons. There are not that many Black male doctors in general. When she saw that, when she wanted to support, when she saw the dedication, she knows what it takes to be a doctor, to be a Black doctor, and to go through some of the things that we go through. She said, listen, I want to give this doctor a chance, and I know I'm gonna put my faith in him, and he's gonna take good care of me. Yeah, now it's just the healing. Yeah.
The first moment I saw myself in the mirror, I saw a younger version of myself that I missed. It was like I saw the girlfriend that I hadn't seen in a couple of months or a couple of years, and we became friends again. So it was a great experience. I never thought I would be the person who got plastic surgery. I didn't think I fit that mold, and I always looked at people who got plastic surgery and thought to myself, why don't you just age gracefully? Why do you need this? And you know, embrace the aging process. There's ageism in this country, and we should learn to love who we are. But when it comes to my personal experience, it really isn't about, now I understand, it really isn't about how anyone else sees or perceives me. It's about what I want for myself. And so, you know, people may look at me and say, why would you get this done? You were always, you know, beautiful. You look great as you were. But that's your perspective. For me, it's what I want to see in the mirror in the morning and what I want to look like. And that is a personal experience for everyone. So I do now have a better and a greater respect for people who decide to go down this path.
Hi everyone, I know so many of you ask all the time where my scars are and want to see them. So let me go through first of all my surgery that I had done. So I'm going to start from the top. I had an endoscopic brow lift and Dr. Truesdale can't even find those scars. There's one in the middle here and there's two in the hairline here, and literally they are not showing at all. You can't see them. Then what else did I have done? I had a little fat transfer to my chins and my cheeks. The fat was taken from my belly button. You can't see any scars obviously from that. I had an upper blepharoplasty where the scars are here. You can't see those either. And then I had a lower blepharoplasty where the incision is actually inside of the eyelid. And then after that, I did have a lip lift, and that incisions are here. Can't see those. I had a little bit of buccal fat removal, and that's from the inside, so you can't see those either. Then I had the deep plane facelift. So the deep plane facelift scars are starting up here, inside, probably about a quarter inside of my hairline. And then they're hidden very delicately in the crease, and Dr. Truesdale really knows how to hide them. So the inside of the crease here, it goes around my ear, back of the ear, and in the hairline back here. And I wear ponytails all the time so that you can't see them. And I guess that's all the procedures I had.